First and foremost, I'd have to say I'm really impressed with Medicover Hospital, your facilities and also the staff that you have, including the nurses, which are very important, anesthesia, the technicians were all top rate. And so first and foremost for a surgeon, if he does not have a good staff or good help, then it's very difficult to do these very complex procedures. Second of all, I think the benefit we've seen of live surgery is that the surgeons here from Romania can actually witness what it's like in real time to do some of these procedures. And these are very technically difficult, hard procedures to do. And when they see a surgeon doing it in real time, they appreciate that all of us don't do things perfectly, that we all have little things that don't always go perfect, but that as a good surgeon keeps moving forward, is able to complete the procedure and do the right thing for the patient. So for me, the most interesting part of the surgery is that Dr. Marra and I have been doing this for now 11 years. And now to see doctors that we first started training, they are now doing the surgery just as well as we do. So I think that's really the most important thing. And for us, the most rewarding is that we have really hopefully created something that they now are teaching the surgeons of Romania, how to do these procedures. And so we have a group of 10 fantastic Romanian surgeons who help us out. And it's now that they are able to do these procedures, for Dr. Marra and I, there's nothing better.
So, the interesting thing about this course was that it was a small course before a larger course, but this provided the participants the ability to see surgical procedures done that we'll talk about in much greater detail. And the way that a surgeon works is really to look at cases and to see techniques and to be able to ask individual questions about procedures. And there's no substitute for seeing a live surgical procedure, so it was incredibly valuable for the people who participated. Each one of those cases deals with a different part of shoulder problems. One was a rotator cuff tear, one was also a rotator cuff tear, but with real inability to use an arm, and the final one was a shoulder dislocation. And each one of those problems we see commonly in the United States, and I'm sure these problems are very common here in Romania. So I think they were all complex in their own way, and I don't think you could say one is more complex, because they all represented the most complex version of that specific problem, which is very common. So I think they were all very valuable in that way. It's incredible, really. The advanced ability of the surgeons here to do operations, their knowledge level has been exponential growth in the last decade. So it's incredibly inspiring to see how quickly they're assimilating this knowledge into their practice, and their technical abilities is really outstanding.
So it's always a big pleasure to be here in Romania, and I can say that in the last few years the quality of the shoulder surgery is growing, and also thanks to the events like this. So I can say that the hospital is really well organized, the quality of the image, of the transmission was really high, and also the participation was really at high level. So I can say that with events like this, the quality of the Romanian orthopedic surgery is growing more and more.
Practic, aceste evenimente sunt topul în educația în această specialitate. Intervenții chirurgicale transmise live din sala de operații, se pot observa tehnici de ultimă oră, implanturi de ultimă generație, și pacienții din România trebuie să poată beneficia de ce este mai bun în domeniul medical, și pentru asta ne ajută foarte mult și colegii din străinătate. Astăzi, pentru intervențiile chirurgicale live, tot timpul ceva poate să nu meargă perfect, și atunci suntem mulțumiți când vedem transmisia a funcționat foarte bine, calitatea imaginii a fost foarte bună, cazurile au fost destul de grele și întotdeauna când vin experți în domeniu, ai tendința să aduci cu ei cazuri cât mai dificile ca să fie și complexitatea și impactul mai mare. Și atunci întotdeauna și inputul lor este crescut.